prevention are designed to address social and health issues in specific communities. These programs engage community members in creating and implementing solutions that promote wellness and prevent problems such as drug misuse, violence, and chronic disease. Discover what community based prevention programs are, their role in the larger community benefits challenges, and the overall impact these initiatives have. What are community based prevention programs? Community based programs involve local residents, community organizations, and other stakeholders in identifying and addressing the root causes of issues such as drug misuse, crime, and chronic disease. They often use a multi-faceted approach that includes education, outreach, advocacy, and policy change to create lasting positive change. By working directly with community members, these programs can tailor their efforts to the specific needs and challenges of the community, as well as build trust and get by inform those who are most affected. Successful community based prevention program require a comprehensive understanding of the social, economic, and political factors that contribute to the problems they aim to address. They also require a commitment to equity and inclusion, ensuring that all members of the community have equal access to resources and opportunities. Benefits and roles of community based prevention program. Community based prevention programs aim to prevent social issues such as drug misuse, violence, and crime along others from occurring in the community by fostering positive behaviors, building healthy relationships, and promoting social norms that discourage harmful activities. One of the main benefits of community based prevention programs is that they empower communities to take control of their healthy health own health and well-being. By engaging community members in the planning and implementation of those programs, they feel a sense of ownership and investment in their successes. Another benefit includes that community-based prevention programs address issues at their root causes rather than just treating symptoms. By identifying, targeting the underlying risk factors associated with a particular issue, especially in hyperlocal regions, areas, and neighborhoods. These programs can prevent the issue from occurring rather than just managing its effect. Community-based prevention programs also serve as a platform to build and strengthen relationships among community members. These programs promote social cohesion and connect, connectedness, which can help to reduce social isolation and increase feelings of belonging and support. Challenges and limitations of community based prevention programs. Despite their many benefits, community based prevention programs also face significant challenges, including finding limitation and the difficulty of sustaining long term impact. Some of these challenges and limitations include limiting funding and resources. Most community based prevention programs operate on limited budgets, which often restrict the scope of their activities and services. This can lead to inadequate staffing, limited outreach, and reduced effectiveness in reaching the target population. Lack of community engagement. Community based prevention programs rely heavily on the active participation and engagement of the community they serve. However, lack of interest, awareness, or trust in the program can hinder community engagement and reduce effectiveness of the program. Limited access to evidence-based intervention. Community-based prevention programs often face challenges in assessing and implementing evidence-based intervention due to resource constraint, lack of training, and limited support from policymakers. Difficulty in measuring program outcomes. Measuring the impact Measuring the impact and effectiveness of a community-based prevention program can be challenging due to the complex and multidimensional nature of social problems, as well as the lack of appropriate evaluation tools and methodologies. Limited sustainability. Community-based prevention programs often struggle to sustain their efforts beyond the initial phase due to funding, staffing, and organizational challenges. Despite these challenges and limitations, community-based prevention programs remain a vital approach to addressing social problems at the community level. By recognizing these challenges and working to address them, stakeholders can better support these programs and enhance their effectiveness. The impact of prevention programs on reducing drug related crime. Prevention programs have proven to be effective in reducing the drug related crime. Research by the National Institute on Drug Abuse found that the drug prevention program can reduce drug use and related criminal behavior in both adults and youth. Additionally, a review of multiple prevention programs conducted by Substance Abuse and Mental Health Services Administration found that the prevention program can have a positive impact on reducing drug use and associated criminal behavior. These programs employ a variety of strategies to achieve their goals. Education and awareness campaigns inform the community about the changes community about the dangers of drug misuse and the legal consequences associated with drug related crimes. These campaigns often target at risk populations such as youth and individuals in high crime areas to deter initial drug use and prevent escalation into criminal activities. Furthermore, prevention programs often include elements of community policing and partnership with local law enforcement agencies by fostering cooperation between the community and the police. These programs help to create a more cohesive approach to tackling drug related issues. This collaboration can lead to improved trust between residents and law enforcement, encouraging community members to report suspicion activities and participate in neighborhood watch program. Intervention strategies such as counseling and support groups are also critical component of these programs, providing individuals with access to mental health services and addiction treatment can address underlying issues that contribute to drug misuse and criminal behavior. Early intervention and continuous support can significantly reduce recidivism rates and help individuals reintegrate into society as productive members. The role of community in prevention programs. Communities can help to identify individuals or groups that may be at risk of engaging in harmful behaviors and provide education and resources to prevent them from doing so. Community involvement is essential in tailoring prevention programs to meet the specific needs of the local population. By actively participating in the design and implementation of these initiatives, community members ensure that the programs are culturally sensitive and relevant. This grassroots this grassroots approach increases the likelihood of success as the intervention are more likely to resonate with the target audience. Additionally, community members can serve as role models and advocates for healthy behaviors and can work together to create safe and supportive environment that promote positive health outcomes. By engaging with and supporting prevention programs, communities can help to create a culture of health and well-being that benefits everyone. Neighborhood association, faith-based organization, and local business can all play a role in supporting prevention program. These groups can offer venues for program activities, finding provide funding or in-kind donations, and mobilize volunteers to assist with program operation. Schools are also crucial partners as they can integrate prevention education into their curricula and provide supportive environment for students. Moreover, communities can advocate for policy change that support prevention efforts by lobbying for increased funding, better access to mental health services, and stricter enforcement of drug laws. Community members can help to create an environment that is conducive to the success of prevention program. In summary, the collaborative efforts between prevention program and community members are vital in reducing drug-related crime and fostering a healthier, safer environment for all. Through education, intervention, and community support, these programs can make a significant impact on both individual lives and the broader community. Evaluation and assessment methods of community-based prevention program. Evaluating the effectiveness and impact of community-based prevention program is crucial to understanding their success and areas for improvement. These evaluations often utilize mix of qualitative and quantitative methods. Qualitative methods interviews conduct one-on-one interviews with program participants to gather detailed personal experience and insight on the program's impact. For example, interviewing parents who attended a substance misuse prevention workshop to understand changes in their attitudes and behavior. Focus groups organize group discussion with community program members to collect diverse perspective on the program's strengths and weaknesses. For instance, holding a focus group with youth participants of a violence prevention initiative to discuss their experience and suggestions for improvement. Case studies develop comprehensive case studies that document individual or community stories and the program influence over time. An example could be a program highlighting key interventions outcomes. Quantitative methods. Surveys distribute structured questionnaire to a large number of participants to collect measurable data on program outcomes. For example, a pre and post survey to assess changes in drug misuse behavior among teenagers after participating in an educational campaign. Statistical analysis. Use statistical techniques to analyze the data collected from various sources, identifying trends and correlations. An example is analyzing crime rate data before and after the implementation of community-based crime prevention program to measure its effectiveness. Pre and post intervention assessments. Conduct assessment before and after the program to measure changes in knowledge, attitude, behaviors. For instance, assessing participants' understanding of healthy eating habits before and after a nutrition education program to evaluate knowledge gains. By combining these approaches, programs can gain a comprehensive understanding of their impact, identifying best practices, and make data-driven decisions to enhance their effectiveness. Thank you. Please subscribe, like, and comments.